Thank you so much for joining me here at the live desk. I am Janae Hancock. Right now, we are going beyond the headlines as we just learned that new COVID-19 vaccines will likely hit drugstores in mid-September. So with that being said, I do want to turn things over to Dr. Dana Hawkinson. He is the Medical Director of Infection Prevention and Control at the University of Kansas Health System. Dr. Hawkinson, I want to thank you so much for joining me here at the live desk today. And I want to just jump straight into it. If you can just break down exactly what does this mean, this new information that is coming in to the news today?
Yeah, no, I think it's good news. Again, we are talking about the newest COVID boosters, and particularly the Moderna and Pfizer boosters. These are going to be a monovalent vaccine or a monovalent booster dose, meaning it is one type basically of the spike. And that spike that they've chosen was an Omicron sublineage. It's a little bit different than the actual variants that are circulating currently, but we still do expect the vaccine to offer very good protection against hospitalization and severe disease for those people that get the vaccine. And there may even be a little bit of protection against infection for the first couple weeks after the booster dose as well. But we do expect it to be efficacious and help reduce your risk of hospitalization and severe disease after getting the booster.
And, you know, Dr. Hawkinson, it's no secret that COVID-19 cases have been on the rise across the nation right now here lately. But who do you think they might consider as far as getting those vaccines once they are released in stores next month?
Yeah, we don't know fully what they're going to recommend. I do anticipate it's probably just going to be a broad recommendation for those people that are 6 months and older to go ahead and get a monovalent booster dose. Of course, those people that are of older age have chronic comorbid conditions like heart disease, lung disease, kidney disease, or those people that are immunosuppressed, certainly going to be recommended for those as well. Again, we will still wait for the final recommendations, but I do overall believe it'll probably just be anyone who is 6 months or older is going to be okay to get that booster dose.
Alrighty, and I do want to take a look at some video that we just received here into our KCTV5 newsroom. And as I do that, I want to give some more background knowledge. As this information was released today, the FDA is expected to give its nod to the updated vaccines in just a few weeks. And then an advisory committee with the CDC will make their recommendation. And after the CDC director signs off, the vaccines can be administered. Now, I mentioned the fact that COVID-19 cases have been going up across the nation. And I just want to list off that statistic there as well. More than 12,000 Americans have been hospitalized with COVID-19 right now, and that number is rising, jumping 22% in the most recent weeks. Well, most recent week, I should say. How are we looking here locally in our area? Do you happen to have that number?
You know, I don't have the full numbers locally. The only thing I have is what's access, public knowledge on the internet as far as hospitalizations in Missouri and Kansas. And overall, yes, as you stated, the percentages do seem high, particularly in the last couple of weeks, the percentage of increased hospitalizations. But if you look at those total numbers, the total numbers are continuing to be very low, much lower than we saw a year ago, and for the most part throughout the pandemic. So although we are seeing increases in the number of cases or circulating virus, maybe we know people who have it or know friends or family who have it, but also, as you stated, hospitalizations. We have been fairly stable here at the University of Kansas Health System. We still have under 10 active patients in the hospital, and we've been at that number for a few weeks. That is a very good thing, but we are continuing to monitor for increases in our active cases as well. We do believe there is increased circulation of the virus, especially since people are going more back into work. School has started now as well. All of those things will contribute to the virus being able to circulate from person to person as well.
I think that that's good news, like you mentioned, the fact that the numbers are not as high here locally. And like you mentioned also, the fact that students are now returning to school. Most of them are already sitting in the classrooms right now. But do you think that parents should be concerned and maybe get their children vaccinated next month?
You know, I think it's going to be important. We know that, again, the young people tend to have less of a risk of hospitalization and severe disease, but it still does happen. And we know that long COVID can still happen. I would still encourage people, when those recommendations come out, to heed those recommendations. And if you fall under that group that is recommended to get the vaccine, I would certainly advise and recommend to follow those recommendations and get that vaccine dose as you can to help protect against those things, but also maybe help reduce your chance of long COVID as well.
And Dr. Hawkinson, just a few more questions for you. I know that we are coming up on the Labor Day holiday, and so a lot of people are going to be traveling. They're going to be with friends and family. What tips do you have for people that are going to be gathered in large environments for the upcoming holiday?
Yeah, I think that's a great question. Again, for the most part, the pandemic is really over for a majority of the population. It doesn't affect our daily lives, but we can't be myopic to the fact that there are people who could still be significantly affected, loved ones, family members who could still be seriously impacted if they get infected with SARS-CoV-2. So it is vitally important, number one, to understand those situations that you are going into, either as yourself or maybe family or friends may be going into. Understand that it's always okay to wear a mask. Masking still does help reduce your risk of infection, even if others around you are not masking. So that is very important as well. We know it's very hot outside, so outdoor activities, unless you're at the pool, probably are not going to happen. It's probably going to be more indoor activities with air conditioning. Just understanding those and being aware of the ventilation in those spaces, as well as the number of people that might be there. So that's important to know and understand what is the risk, what are those situations you're going into, and then also understand and have a plan. If you do have symptoms, it is very important to test early. If you're using a home test, you may have to test 2 or 3 days in a row to see if you can get an accurate diagnosis. We know those home tests, you have to test multiple times. And getting tested early is very important because if you are at risk of hospitalization and severe disease, i.e. if you're older age, if you have immune compromise, if you have chronic conditions, it is very important to get seen by a medical professional to get on that oral antiviral Paxlovid as early as possible if you are able to. So all of those things are vitally important as we are going now into not necessarily colder weather just yet, but school is starting. We know that people are going to be inside doing things more, classrooms, get-togethers, all of that. It's important to understand that and understand to have a plan if you do start to get symptoms as well.
All righty, and just one last question for you, but we typically this time of year before the COVID-19 pandemic, we think about this season as the flu season. So are we just starting to compare those two, and when you get your flu shot, also consider getting that COVID-19 vaccine as well to better protect yourself?
Yeah, I think that's very important. And last year, it is certainly okay to get both influenza vaccine and the COVID vaccine at the same time. That is vitally important. We are seeing COVID, although, again, the circulation of the virus has continued throughout the year. It has certainly been lower in these warmer months. We do expect it to go up and become a more seasonal virus, like the other common cough and cold viruses, like influenza, just because people are indoors, going to be crowded together. So it's vitally important to get vaccinated for influenza and also get your COVID booster as well. The other thing is we also know that there's another respiratory virus out there, RSV, or respiratory syncytial virus, which really affects the very young and the very old in significant ways. So if you do fall under recommendations for the RSV vaccine, which will be available this fall as well, it's vitally important to get vaccinated against RSV also. And I think those recommendations are for anybody who is 60 and older to get that vaccine.
I do want to add one last detail, Dr. Hawkinson. Thank you so much for joining me here at the live desk as we take a look at this video. Now, while vaccines were previously provided for free by the government, this is the first time vaccines will be provided through the commercial market. Again, the new COVID-19 vaccines will likely hit drugstores in mid-September. And we'll provide more details here at KCTV5 as they come into our newsroom. So be sure to have the KCTV5 News app on hand. It is available in all app stores right now. Thank you so much for joining me here at the live desk. I'll be back with more news updates.